A very good evening once again, and that brings us to session number 17, Safe People, Safe Places, Occupational Health Standards and Infection Control in Healthcare. We now move, at its core, healthcare is built on a simple promise, to do no harm. The session brings into focus the critical role of occupational health and infection prevention in creating truly safe environments. We are honored to have our chairpersons for the session, Dr. Raju Sivasamy, VP, Medical and Senior Consultant, SRM Institute of Medical Sciences, Chennai, and Dr. Sheikh Mohyuddin, Chief Quality Officer, Al Dafra Hospitals, UAE. Thank you for guiding this important discussion. We now welcome our speakers, Dr. Manodeep Sen, Professor, Department of Microbiology, Dr. RML Institute of Medical Sciences, Lucknow, who will be speaking on applicability of vaporized hydrogen peroxide for environmental disinfection at healthcare settings, a topic that brings attention to the science behind safer environments and infection control practices. Next, we invite Mr. Anshul Gupta, founder and CEO, Clean Pvt Ltd, who will take us through hospital-acquired infections and their growing impact on patient safety. A conversion that reminds us how infection control is not just a protocol, but a patient safety imperative. I invite our speakers to take the session forward.
So today's topic is safe people and safe places. The OSHS standard, operational health practice in administration. Today's topic is applicability of vaporized oxygen peroxide, hydrogen peroxide for environmental disinfection for healthcare settings. Now I'd like to call upon Dr. Manodeep Sen. You have any presentation? Now the stage is yours. All these years we have been vaporizing with formalin, then surface solutions, and hydrogen peroxide has been used in the surface wounds. Now vaporized hydrogen peroxide has come. Let us go through the presentation and how far it will be useful for the public, for the environment, and the patient care. Thank you, sir.
So, thank you, respected chairperson, for the kind introduction. And I would first like to thank the organizers as well as India for giving me the opportunity to deliver this presentation before you. So, the topic is applicability of vaporized hydrogen peroxide for environmental disinfection at healthcare settings. So to introduce disinfectant for critical care areas is, there is no ideal disinfectant, and main three issues which are very vital are it's the site of action, efficacy as well as compatibility, both material compatibility as well as biocompatibility. So hydrogen peroxide, we all know that it's a disinfectant and sterilant by action. And it can be aerosolized or it can be vaporized. Next, its mode of action is mainly as a strong oxidizing agent, and which leads to rapid cell death of the microorganisms. So overall spectrum is that it is overall bactericidal, virucidal, mycobactericidal, and even sporicidal. So I'll also later on touch upon the EN certificates based on these activities. So of all the common percentages and its strength of action, I'll mainly concentrate upon its vaporized form, which is at 7.35%, hydrogen peroxide 0.23%, of peracetic acid, which actually stabilizes it and renders it effective onto environment, surface as well as medical instruments. So It's mainly its applications are in disinfection of surfaces, instruments, and hospital areas. And vaporized hydrogen peroxide can be also used for room decontamination or terminal disinfection. So the advantages of a hydrogen peroxide solution are widespread. It's basically widely available. It is inexpensive in its dilution, and it is stable. It has to be rendered stable by the accelerated hydrogen peroxide technology, and it is compatible both with surface materials like as well as it leaves no toxic residue. It breaks down into water and oxygen. So it is environmental friendly. So its advantage is that its vaporized form is a breakthrough, and it has been recognized by FDA also for its sterilization method. So as I said, that when combined with peracetic acid, which is a strong oxidizer also, so it has been shown to be active against difficult MDR organisms like Clostridioides difficile as well as Candida auris. And it is high-level disinfectant for operation theaters as well as ICU. So for an ICU, when patients are admitted, we are very much concerned about patient safety as well as the biocompatibility. So we know that peracetic acid itself is biodegradable, and it is also resistant to degradation. And very important, it is active even in presence of organic matter. So, as I said, vaporized hydrogen peroxide, it has also EHP or escalated hydrogen peroxide technology, which renders it stable. And it has a uniform penetration into hard to reach surfaces. That's why its applicability into enclosed surfaces like the ICUs. And as I said already, material compatibility with steel, plastic, glass, and very important, it can be diluted, which renders it sporicidal. And dilution is 50 to 65 ml in 1 liter of demineralized or RO water, and with a contact time of only 20 to 30 minutes, which can cover an area of 100 to 200 cubic meters. So that's why I said it is cost effective also. So these are some of the EN certifications which I introduced initially: sporicidal, bactericidal, virucidal, both enveloped as well as non-enveloped viruses, mycobactericidal, yeasticidal. So there are additional certifications we can look upon, like the ISO 901 quality management system, ISO 13485 for medical purpose quality management system, and the most important, the compatibility issues of ISO 21530, and also WHO good manufacturing practices compliant, and C certified with both MDD, Medical Device Directive, as well as Biocidal Product Directive. So I've already stressed the importance of biocompatibility of an environment disinfectant, especially in critical care areas where you cannot shift the patients. So the issues of skin corrosion, skin irritability, eye irritability, as well as respiratory toxicity is vital. So it has also all the certificates which corroborates that it is compliant to this biocompatibility. CDC has already approved it as a chemical sterilant, and WHO had also recommended during COVID-19 outbreak, rendering its role in the hospital care acquired infection reduction as well as outbreak prevention. So advantages are, just to summarize, it mirrors the image of an ideal disinfectant because it is environmental friendly, it is non-corrosive, it is biocompatible, it is surface compatible, and it has rapid action vaporization capacity, and it has inbuilt corrosion inhibitors and low concentration, high efficacy. So it has also optimized consumption, low chemical cost, and so it will, reduce your manpower, because already when incorporated into vapor, You don't need a lot of equipments, and you can also conserve on the manpower, and which helps to, reduce this healthcare associated infection, associated financial burden. And it is, of course, environment safe, staff safety. All these issues are taken care by this product. And to summarize finally, this advanced vaporized hydrogen peroxide and this EHP technology is there for its stabilization for complete disinfection. There is a proven broad spectrum efficacy with European certifications. Then, of course, there are biocompatibility, non-toxic, non-irritant, excellent material compatibility as per ISO 21530 certification, and it has ideal for high-value equipment for a modular OT, because I said that they reach the hard-to-reach surfaces. It is environmental safe, friendly, as well as cost-effective because of its dilution, 50 to 65 ml in 1 liter in RO water, which can cover, once vaporized, which can cover entire 100 to 200 cubic meters of surface. So it is not confined to flat surfaces only. So, and it is globally compliant, and it is a chemical sterilant, which I have shown. So this is in essence the summary of this vaporized hydrogen peroxide technology. I would just end by saying that the theme of this conference being tech, touch and trust. So it's a technology which has evolved. It has safe to touch, that is, it is biocompatibility issues are there. I mean, it is safe and it is biocompatible, and it has earned this trust and built its trust upon these issues. Thank you so much.
Thank you, sir. Thank you, Dr. Manodeep Sen.
Thank you, sir.
I have a few questions, sir. I have a few questions. So what is the action time duration which has to be kept in the operation room or the ICU?
I couldn't hear you, sir.
The action time for the hydrogen peroxide. Any idea?
Yes, I'll come on. Yes, sorry, sir.
The action time for the hydrogen peroxide. How many hours you have to keep it in the ICU?
Yes, sir. So the contact time is only 20 to 30 minutes.
What about the protection, sir? Previously, it was used in the plasma sterilization, where it has to be kept a separate exhaust. In the ICU, how do you manage this?
So, sir, it has to be, as I said, that it's a compound. It can be only for sporicidal action, 50 to 65 ml in a RO system, and it is given into a vapor machine.
Okay.
That's it, sir. So it cannot, you need not have any other equipment other than your vaporized machine.
What is the safety margin of the healthcare
Safety,
workers?
yes, sir, I just showed you,
Healthcare
sir,
workers who is using that? The housekeeping boy, or healthcare worker who is using this?
Yes,
the safety
yes,
aspect.
all the trained staff can very much use it. That's why I said both patient safety and staff safety, sir. Because hydrogen peroxide at the most it will break down into water and oxygen and paracetic acid also, sir.
Okay.
So, the staff has to be trained, and it is very easy to use. That's why I said we can conserve manpower based on that, sir.
Okay. Thank you, sir.
Thank you, sir.
So any question from the audience? Is a practical issues. All ICU, OT, ward, isolation, BMT. Okay, sir. Thank you. Now, Doctor, I request Mr. Anshul Gupta, founder and CEO of the Clean Pvt Ltd. Now, stage is open for. His topic is hospital-acquired infection and their growing impact on patient safety.
Good afternoon, everyone. Each one of you work every day tirelessly to save lives. I think we all need to give a round of applause to all the healthcare professionals here. Guys, come on, it is for you guys only. Hello? Hello? Cool. Okay. So guys, What if I tell you that some of the patients who visited your hospital didn't came with illness, but they left with one? Globally, hospital-acquired infections. Globally, hospital-acquired infections are affecting millions of lives every year. In India, it is 5x. 1 out of every 4 patients who visit hospitals get affected by hospital-acquired infections. But the real question is, how much of that is preventable? And are we looking at the right pace? We all understand, we've been talking last 3 days about vectors of infection, areas to look at, WHO focus on hand hygiene. But we focus on what? Contact as a vector of infection, airborne disease, insects, food, water, dietary services, invasive. Are we missing anything? Come on guys, anything? What about linen? Do we ever consider linen as a vector of infection? Great, ma'am. But based upon my interaction with a lot of hospitals, most of the administrators may not be aware about how the linen is being handled. Day before yesterday, I was addressing to 350 odd healthcare professionals from Tamil Nadu and asked them a question: how many of you have actually visited a laundry or you know about how linen is being managed? I'll give you a small example. When a doctor comes to attend a patient, he will first rub a hand rub, right? Disinfect his hands, hand hygiene. But what he will do next? He will hold this curtain and close it to give privacy to the patient. But he just compromised the hand hygiene. Because why? Most of the hospitals don't wash their curtains for 6 months. This is what is happening. And there's a recent study which said MRSA. Just 1 minute. Yeah. So as per Journal of Clinical Microbiology, MRSA, which I cannot pronounce, it's a tongue twister for me, right, can survive 90 days on linen. And every patient wears patient kurta pajama, doctor's coat, while we pass everything through CSSG, only what goes in OT. But what about every other linen? Patients wearing their, nurses wearing their uniforms, traveling through public transport, going home, exposing their family, all the people they interact with. There has been studies globally where outbreaks were identified to be related with linen. But see, we all look at sensorial hygiene. Day before yesterday, again, there was a session which talked about laundry practices, and they were talking about dirty linen and soiled linen. As per them, which is visibly dirty with blood stains, excretion and everything, should be treated as infected linen. Everything else should be dirty and can be washed in normal washer extractors and everything. That really works in a hospitality environment, but not in healthcare. Why? Because when we look at only clean linen, we are talking about visibility, smell, and touch. That's what is being considered right now as the linen standards in every hospital. But what if I say, can we see bacteria or virus by naked eye? In healthcare environment, what matters is hygienically clean. I'm happy to get a grey bed sheet, but it should be infection-free without any virus and bacteria. How can we achieve that? Can you remember anything from this slide? What? COVID, yes, exactly. 5 years back, we saw this empty roads, this laughing virus pushed us all back in the home. Empty roads again, everybody was scared, sitting in home. Then we applied something. We all started wearing masks. What was that? Trying to create a physical barrier so the aerosols infection cannot spread through air. What we did with our family members who got infected, we confined them in closed doors, again creating a physical barrier. Because what COVID taught us, we already knew that infection can spread through contact, airborne, food, medium, any touch, any surface. But do we apply that when it comes to linen management? Most of the hospitals have two modus operandi. One, either they send it off-site, which they're not even aware how it is being managed, or they have an in-house laundry, but a technology or the way which is very primitive. The world has moved towards a barrier concept. We all are applying this concept in our CSSGs, where we create a physical partition between dirty and clean side. We ensure there's a negative and a positive air pressure so that the bacteria or virus cannot move by air. Operators working on dirty and clean sites are different. All the trolleys, accessories are different. So that we ensure that by process and by physical barrier, we eliminate any chance of cross-contamination. And that's what we are trying to implement. As quickly, we were the first company to introduce this concept in 2013. By creating a physical barrier using French standards of hygiene and linen management, we have implemented this concept across 14,000 beds in India. Central government AIMS Hospital has adopted barrier concept in laundry as the way forward. Currently, we serve 5 AIMS hospitals in India, and all the AIMS hospitals are designing and upgrading their laundries as per barrier concept. How does it look like? So you create a physical barrier. The machines have 2-door system. So you enter the linen from the dirty side. After chemical and thermal disinfection, it goes on the clean side. So this is like a forward-looking flow. I can just give you a demonstration of how it works. So step 1 is the linen comes to the dirty side of the laundry, gets stored in closed containers. It is then pre-sorted for anything which might have come along with the linen. Then is actually put in the washers to be treated as per the right temperature and the right chemicals. Post which it goes into the respective stations of finishing. Flat linen will go in flat work ironers. The linen which needs to be dried will go in dryers. And the rest all go for finishing uniforms. And then again folded, packed in closed containers and shipped to the ward. Also what we do is create a negative and positive air pressure to ensure that there is no cross-contamination by air. Another thing, we as India, we are a country which loves cricket. Just imagine there's an India-Pakistan match and your operators want to rush home to watch cricket. What they will do? They will try to fast forward the program and push and finish the work faster. Do we agree, right? That's what we do when there's an India-Pakistan match in the evening. But we have an embedded system called Hygiene Watchdog. If an operator tries to push forward or fast forward a program, until unless the linen goes through a proper thermal and chemical disinfection, it doesn't go through a complete cycle. The linen will go back on dirty side, which means a process and a technology will ensure that there is no room for compromise and every time we get hygienically clean linen. So as quickly, like I mentioned, we have been serving healthcare from last 14 years now, serving 14,000 beds. We are scaling up. We are here. We're glad to partner with any organization. We have a zero capex model. So I just want to show you a small video of what Quicklin is, and then I can briefly cover it up in 1 or 2 minutes. Excuse me, can you play the video, please? Just to share you guys while we play the video, that we have a zero capex model where a hospital does not need to invest anything in creating the infrastructure. We believe that linen should not leave the premise, a dirty linen. So we set up the facility inside your premise with zero capex to the hospital. We deploy our own manpower. We take care of all the costs associated, chemicals, manpower, electricity, water, gas, maintenance of the equipment throughout the contract. And also we provide 3-par linen if you want. As per your standards, co-branded with your brand of hospital, you just need to pay us per patient, per night, per occupied bed, that's it. Which varies between ₹80 to ₹160, depending upon the scope. And we collect ward to ward. So everything from linen management, bed to bed, apart from laying out of the bed, is handled by us. And that's what, like I said, we've been doing it for multiple hospitals.
Imagine a world where your laundry worries are a thing of the past. Welcome. Imagine a world where your laundry...
currently we are,
Imagine a world where your laundry worries are a thing of
so guys, currently we work in 38 cities. Like I said, we work with AIIMS Hospital, Leelavati Mumbai, Bombay Hospital. We did a very big setup to handle
Imagine a world where your laundry worries are a thing of the past. Welcome to Quick Clean. Imagine a world where your laundry worries are a thing of the past. Welcome to Quick Clean.
I can see on the monitor.
Imagine a world where your laundry worries are a thing of the past. Welcome to Quick Clean, your ultimate partner in commercial laundry solutions. Now more than ever, achieving a sustainable future is a matter of choices. At Quick Clean Laundry Systems, we firmly believe that the decisions we make today can help create a better tomorrow. Quick Clean is more than just a supplier. We offer end-to-end solutions from startup incubation and facility design to construction, marketing, and delivery. Our expert team ensures that every client receives personalized support tailored to their unique needs. Our diverse offerings include build, own, and operate models, turnkey projects, linen rental services, valet laundry setup, and equipment on lease, ensuring we cover all aspects of your laundry requirements. We are committed to sustainability. Our products are designed to minimize water, energy, and detergent use, making us a responsible choice for the environment and your business. With over 5,000 customers across various segments, pharma, railways, healthcare, hospitality, and dry cleaners, Quick Clean is a market leader in sustainable laundry solutions. Our on-premises laundry solutions are present in 36 cities across India. Our footprint extends across multiple major hotel chains, spanning numerous locations and ensuring that high-quality, sustainable laundry solutions are always within reach, no matter where you are. We are proud to partner with industry leaders, deliver an exceptional service and innovation that set the standard for excellence in commercial laundry. Quick Clean serves renowned hotels like Taj, ITC, and Marriott. We offer cost-effective and innovative solutions, including zero CapEx options, boilerless operations, and zero discharge wastewater setups. Our advanced technology reduces water usage to as low as 3 liters per kilogram, maximizing efficiency and sustainability. Join us on our journey to revolutionize the laundry industry.
We are Quick Cleaners.
And we are here to make your work life easier, more profitable, and truly sustainable.
Hello.
So guys, like we talked about, we are serving hospitality and healthcare both. And what we mentioned here was, this is a footprint across India working with major healthcare chains. Which we are proud to share is that we are the most sustainable laundry solution company in India. Till today we have saved millions of liters of water because any company in India washes at almost 18 liters per kg. We do it at 3 liters per kg now. We used to do it at 9. And we can actually even set up a complete recycling system when it comes to setting up an on-premise laundry. So that's what we are revolutionizing the industry with. And the first ever ESCO certified laundry company in India, which is certified from Bureau of Energy Efficiency. And we're the first company to win the Global Sustainability Award and Innovation Award from CNET. Thank you so much. And we look forward to interact with you. If you want us to come on board, happy to do that. Thank you so much.
Thank you, sir. Thank you, Mr. Anshul Gupta, sir. On behalf of the CAHOCON, I would like to thank Dr. Manodeep Sen and Anshul Gupta for their valuable inputs on over standard infection control in healthcare practice. Thank you, sir. Thank you.